Hello friend, welcome back to my channel.
We are going to learn about maxillary branch of trigeminal nerve. Discussed in previous video that the trigeminal nerve arises from bones and it gives both the sensory and motor root, and the V1 V2 got a sensory while V3 got a motor and sensory both. Now today we are going to discuss from trigeminal ganglion. This is the trigeminal ganglion. From here V1, V2 and V3 arises. And it passes through the four different areas. That first one is middle cranial fossa, and second one is pterygopalatine fossa. Third one is infraorbital canal, and the last one is on face. In middle cranial fossa, as the V2 passes, it supplies to the dura mater of middle cranial fossa, and it continues and cross through lateral wall of cavernous sinus. As it passes through the lateral wall of cavernous sinus in pterygopalatine fossa, it gets exit from foramen rotundum. And make a ganglion named as pterygopalatine ganglion, and then it passes through the fissure named as inferior orbital fissure, and goes to the canal called as inferior orbital canal. And before entering into the inferior orbital fissure, it gives to the branch of posterior superior alveolar nerve, and it supplies to the posterior tooth. That means it supplies to the molars. And after entering through the inferior orbital fissure, the name change into infraorbital nerve, and it gives branch to MSA and ASA. That means middle superior alveolar nerve and anterior superior alveolar nerve. And middle superior alveolar nerve supplies to the premolar tooth, and anterior superior alveolar nerve supplies to the anterior tooth. That means canine, lateral incisor and central incisor. Now, and the another branch is before entering into the inferior orbital fissure, it gives a zygomatico. So before entering into the inferior orbital fissure, it gives a branch to a nerve, that is zygomatic nerve, and it passes through the inferior orbital fissure, and infraorbital canal it gives to the two branch, that is zygomatico-temporal and zygomatico-facial, and it supplies to the skin of temple, and zygomatico-facial it supplies to the skin of face. Now, after passing through this canal, the infraorbital nerve exits from a foramen called inferior orbital foramen and gives three branches, which are palpebral, another one is nasal, and the last one is superior orbital. And the palpebral is supplied to skin of the lower eyelid, while the nasal supplies to the side of the nose and the mobile part of the nasal septum, while the superior orbital supply to the skin and the mucous membrane of upper lip. Guys, now let's get summarize all this thing. After it passes from the trigeminal ganglion, the V2 supplies to the dura mater of the middle cranial fossa, and it crosses through the lateral wall of the cavernous sinus and passes through the foramen rotundum and make a one ganglion named as pterygopalatine ganglion. And there is an inferior orbital fissure. Before entering into the inferior orbital fissure, it gives to the branch called as posterior superior alveolar nerve, which supply to the posterior tooth and the palate, also the palate, and the another branch is a zygomatical nerve, and it crosses through the inferior orbital fissure and gives a two branch called zygomatico-temporal and zygomatico-facial. Zygomatico-temporal supply to the skin of the temple, while as zygomatico-facial supply to the skin of face. And as it passes through the inferior orbital canal, the maxillary branch change the name as infraorbital nerve, and it gives to the two branch, that is medial superior alveolar nerve and anterior superior alveolar nerve, and after and it exit from the inferior orbital foramen, and after exit from the inferior orbital foramen, it gives to the three branch, that is palpebral, nasal, and superior orbital on face, and the palpebral supplies to the skin of the lower eyelid, while as nasal supply to the side of the nose and the mobile part of the nasal septum, while the superior orbital supply to the skin and mucous membrane of the upper lips. Thank you, hope you like it, guys. Now let's get summarize all the things of maxillary branch of trigeminal nerve. As the trigeminal maxillary branch get exit from the trigeminal ganglion, it supplies to the dura mater of the middle cranial fossa, and it crosses through the lateral wall of the cavernous sinus, and it passes through the foramen rotundum and gives a one ganglion named as pterygopalatine ganglion. and it after passing through the foramen rotundum, it gives to the one branch that is posterior superior alveolar nerve, and which supplies to the palate and the posterior tooth. And it gives to the another branch named as zygomatic nerve, and which is passes through the inferior orbital fissure, and gives a two branch, that is zygomatico-temporal and zygomatico-facial. Zygomatico-temporal supply to the skin of the temple, while as zygomatico-facial supply to the skin of face. And as the continuation of the maxillary nerve, after passing through the inferior orbital fissure in infraorbital canal, it name change into the infraorbital nerve, and it gives to the two branches that are medial superior alveolar nerve and anterior superior alveolar nerve. Medial superior alveolar nerve supply to the premolars, while as anterior superior alveolar nerve supply to the anterior tooth and the anterior tooth. And the maxillary nerve get exit from the inferior orbital foramen, and it gives to the three branches that are palpebral, nasal, and superior orbital on face. And the palpebral supplies to the skin of the lower eyelid, and nasal supplied to the side of the nose and the mobile part of the nasal septum, while as superior orbital supply to the skin and the mucous membrane of the upper lip. Thank you guys. I hope you like it, and thank you for watching. And if you have any queries, then you can ask me on the comment section, and do not forget to like, share, and subscribe.